I'm delighted to be here with you all this morning in this gloriously cool room. So thank you to City Council for hosting the conference today, to Mike and Elliot and the sponsors for making it happen, not least because of the gravity of the issues that we are talking about today. We know that many of the problems that lead to adverse childhood experiences, whether it's domestic violence, drug or alcohol misuse, mental health problems, financial stress, money worries, are part of a cycle of harm that can lead to multi-generational consequences. I see it in my constituency and in my constituency surgeries. And so we therefore all agree that it's right to intervene when there are reports of these experiences. And the debate that Mike was referring to in Parliament was off the back of a select committee report that I was part of and co-sponsored the debate in Parliament on, looking specifically at the first 1,000 days of a child's life and the evidence that underpins the consequences of adverse childhood experiences within that period of time, and the data that was showing the consequences for those young people as they grow and become adults. And we know from the evidence that that's a crucial period of development and growth for young people. And obviously, these issues are about healthcare, they're about science, they're about partnership working, but they're also political. And we do see time and time again, not always, but we do see time and time again that these issues are related to poverty and inequality, and not just in parts of Bristol, but across the whole country. But that's why I'm really proud to be Bristolian and to be one of the MPs here at Bristol, because our City Council, under Ash's leadership, has really invested in this area of work. And that's partly about partnership work, because of course no one organisation is able to do this all together. And so it's fantastic that there are more than 50 partner organisations that have signed up to the vision and the policies that Ash has just set out across education, policing, probation, the voluntary service, health and social care, public health, and the Mayor's office. This is all part of our Mayor's One City Plan approach to the city, which was novel and innovative, and has added enormous amounts of value in lots of areas of the city's life, but crucially in areas such as this too. As Ash mentioned, the pledge under the One City Plan is that all children in Bristol should be able to grow up free of adverse childhood experiences, having had the best start in life and the support that they deserve through their life. But this is not just a local issue, this is a national issue too. And as Mike mentioned, I and colleagues on a cross-party basis have worked on this issue over a number of years in Westminster and raised it with ministers. And we all agreed, indeed the minister agreed, that we can't just rely on local authorities and their partner organisations to do all of the heavy lifting. You're on the front line of this experience, because you don't have the relationships with the people who need your support, but you also need support from central government. We call for a national strategy based on prevention from government. And there are a number of examples as to why we felt that was needed. One example, my colleagues and I had very grave concerns about the shortage of health visitors within the National Health Service. David Cameron, as Prime Minister, made a good pledge that was supported cross-party about health visitor numbers and every family having support and contact in those early stages. But as we know, the recruitment and funding to allow that to happen never followed through. We've also seen from a local authority perspective across the country a decline of about 48% in the last decade in local authority spending on early intervention, not because councils don't care or because they don't want to spend the money on these issues, but because it's been a decade of funding cuts to local government. And so I'm proud that even in those very difficult circumstances, whether it's about policy or whether it's about financing, that Bristol has been able to find the money, take the tough decisions to create our family hubs, to protect the children's centres that preceded them. And I would like to pay tribute to our Mayor, Martin Rees, our Deputy Mayor, Asher Craig, and as Asher mentioned, her predecessor for this brief, a former councillor in my constituency, Helen Godwin, for their work. Unfortunately, as you all know, there is more to be done. Even though there was consensus that this is an issue that required a national strategy, national resourcing, national intervention, sharing of best practice across the country, we have not, in my view, seen enough out of Westminster to make that happen. And there are lots of stresses and pressures in the system now as a consequence. So I hear from GPs, local health services in my constituency, schools in particular, that they're having to take on more and more of the responsibility that maybe other services would have had to have done in the past. That's a pressure for those organisations, not just in terms of everything else they have to do, but because sometimes they don't feel qualified necessarily to make those interventions, to be able to support young people in the way they feel they need to. But they are doing their best. One head teacher from a school in my constituency told me that they had to use some of their pupil premium funding, which is in theory there to help accelerate young people's opportunities in education, to pay for washing machines in their school, to help wash the children's clothes, to clean the children, to provide basics, food and support for them. They had to use the funding to pay for extra staff to be able to build that personal relationship with families, to be able to go and pick them up from home, to bring them into school if they were not coming to school. This was using the education budget, the school budget, for services that we would hope would need to be needed in the first place, but not necessarily should be the function of our schools and our teachers. The frustration is, of course, there are loads of examples. There is loads of evidence. This conference is a great example here in Bristol. There are counterpart organisations across the whole country. But we do need that focus and that concentration from Westminster, prioritisation of wanting to tackle this issue. And that's why the topic of this conference today is so important, because whilst it's right and proper to help young people and adults who have suffered the consequences of neglect and abuse, it's the right moral thing to do, we know there are costs by not doing so. And so the public policy offer is that yes, it might be a cost to put forward a national strategy and funding and resource allocation from Westminster, but actually there's a saving on the other end. It makes logical sense, not just the right thing to do. There is an economic case for it to be done. And I think not just in this area, but lots of policy areas, we are able to continue to make that case. And so the evidence that you're able to bring together today, the contributions from your partners, I look forward to seeing at the conclusion of the conference so that we can take that message to ministers. You might have seen there's a bit of change going on in Westminster, but there will be some new ministers later this year who I will go and see and welcome to their department and offer the evidence and conclusion that you have put together for us. Just lastly, on some local matters. Now, Mike, you've been getting a lot of good airtime this morning, and I'm sorry, but I'm going to have to add to it. Because, as Asher alluded to, Mike is not only a great advocate and champion for this cause and for this community, but he's a great lobbyist. And every time a new politician enters the scene, Mike is there, charming, thoughtful, polite, considerate, but making the case. Cross-party basis, every possible level, whether it's local councillors, whether it's the mayoral cabinet team, whether it's parliamentarians, whether it's ministers in Westminster. And the Southmead project, the Southmead community where Mike is from, is of course in my constituency. I grew up in Lawrence Weston, just around the corner, and so I want to pay tribute to Mike for all the work that you've done over 30 years now of work in this area. The trouble is we know, and this is one of the reasons Mike is a good lobbyist, that a lot of the work that you do, because it's not supported as part of a national strategy, can be difficult. The Southmead project, for example, has to rely on charitable fundraising, philanthropic donations, and sponsorship of local businesses. It is a constant effort to get the money in the door to pay for the activities and the services that you know are so desperately needed by the people coming to see you. And that's the case across Bristol, whilst at the same time demand for services is increasing. Some statistics I was provided with, which just give an example, is that across the country, 200,000 children under the age of 1 live with an adult who has experienced themselves domestic violence or abuse. That's something where support should be provided. And 2 million children under the age of 5 live with adults with mental health problems, and we know on that side of the balance sheet that our mental health services are not adequately providing support to people who need it too. So despite all of the best efforts of all of your organisations, the message I want to leave you with today is that we must all continue to make the case nationally. We want to support your organisations in what you're doing. It's great there's such a network of support here in Bristol and through the council. But if we're going to really deal with this issue, we need someone to grab hold of it in government and to put in probably quite a long period of support over many, many years to tackle what is a very difficult structural issue. But at the heart of it, and the heart around the economics of this issue, is that individual child who, through no fault of their own, suffers an adverse childhood experience. And for those of them that suffer multiple experiences, go on to have difficulties in life, which is deeply sad, deeply unfair, and deeply injustice. And what it results in is a loss of potential, and a loss of opportunity, and a loss of contribution, a loss of fulfilment for themselves, for their family, for their community, for the economy, and for our country. And let me tell you, in our country at the moment, the economy is in a very difficult position. We do not have enough people with the right skills in the right places to do all of the right jobs. There is huge amounts of pressure around being able to keep our economy growing and to deliver our public services. And what that means is that we need every single person to be given the opportunity to be skilled up, to be educated, to have fulfilling work, to be able to contribute to the national effort, so that we have a strong economy, strong public services, strong, successful and sustainable people and communities. So I hope I've illustrated that whether it's on the basis of my constituency work, my constituency surgeries, or the work that we do in select committees in Parliament, or the work that we do with our partner organisations in the places in which we work, there is a desire, there is a demand in Westminster to want to partner with you to try to make the case to government, but also a recognition that it is the people that we represent, their children and their futures, that are also at the heart of that endeavour. And so as one of your local MPs and someone that supports this work in Westminster, I stand shoulder to shoulder with all of you in making that case. Thank you so much for inviting me this morning and for putting the conference on. And I pledge to look forward to reading the conclusions of today and helping take that message back to them. Thanks so much.